Because of the fear and the worry about the surgeries, they tend to wait. Hopefully that with non-surgical treatment, they improve. So sometimes the knee becomes so bad that they really cannot walk, cannot stand. My name is Dato Dr. Joon Kiong. I'm an orthopedic surgeon and working in Beacon Hospital for more than 10 years now. Every day in the clinic, we see patients come to us with knee pain, and they also notice the knee become crooked and they have difficulty in the daily activity like squatting, climbing stairs, because they have a lot of pain when they stand and walk on the knee. So the whole joint is getting changed to artificial joint with a set of metal and plastic. So after surgery, they do not have that kind of bone grinding on bone pain anymore. Conventional total knee replacement has been done for many years. It's a very successful sort of surgery. But for the last 10 years, I think the robotic-assisted surgery comes in, and that overcomes a lot of man-possible related errors. We use robotic-assisted surgery to assist us, to support us as a complementary sort of way of doing the surgery in a more precise way. But it still falls back to the surgeon's heart and the skill and also the experience and the touch. So I will not use the word robotic surgery will replace human, because when we do surgery on a patient, we are not operating a knee, we are operating a patient, a person. If you have knee pain, see the doctor, see the specialist in the hospital, get a proper assessment, proper diagnosis, and also the treatment.